Before we get started, I've been asked to make an announcement just to make sure that if there's anybody who is here for the judiciary hearing, which is after this, we want to make sure that you're aware that this is the hearing for the Opioid Abatement Advisory Commission. So I've been asked to make that announcement just to make sure. Again, if anybody has their lights left on, we'll also make sure that announcement takes place. Also, in the back by the door, there is a sign-in sheet for those who want to speak during the public comment section. So I want to make sure that everybody's aware of that so we're able to recognize you and to move forward with that. And with that, we'll go ahead and get started. Again, my name is Chris Evans, the Executive Director for the Opioid Abatement Advisory Commission. I'd like to welcome everybody with us here today, and I'd like to thank all the commission members for being present and being here with us today. We will have a change. I know one of the members is on their way, and we have somebody in place until then. Being this is our first meeting in this location, I do want to make sure to point out to everybody that for the technical aspects of this, and again, this is our first time, we look forward to them working as designed, but make sure that anybody who's speaking will key their mic and see that they have the green light on. That will make sure that the cameras and the microphones register and we're able to record and pick up what's being said by the commission. So with that, we'll move right into the roll in attendance. Representative Bentley? Here. Ms. Butcher?
Here.
Mr. Cameron?
Here.
Mr. Allen?
Here.
Dr. Freeman?
Here.
Mr. Brinsel?
Here, President, designee for Secretary, Eric Friedlander.
Mr. Ingram?
Here.
Mr. Skaggs for Mr. Metcalf?
Here.
Ms. Purdy?
Here.
Dr. Roop?
Here.
And with that, we have all members accounted for and we have a quorum, and we will go ahead and move forward with our agenda for today's meeting. I'd like to first move into the adoption of the agenda. I want to confirm that all members have received a copy of the agenda and have had the opportunity to view that agenda. Seeing that is the case, I will ask if I can have a motion to approve the agenda.
So be it.
Motion made. May I have a second?
I'll second it.
Second by Dr. Roop. Thank you very much. The motion passes. The agenda for today's meeting will move forward as scheduled. Secondly, I would just want to point out, and again for the record, highlight the pending meetings coming up in the business meeting schedule for this commission. The next meeting is scheduled for May 14th, 2024 at 1 p.m. That follows that is July 9th, 2024 at 1 p.m., September 10th, 2024 at 1 p.m., November 12th, 2024 at 1 p.m., and all business meetings will take place at Capitol Annex, 702 Capitol Ave, Frankfort, Kentucky, and the rooms will be assigned based on availability. And that is the scheduled meeting for the remainder of the year. Next, I just want to move forward to the minutes and make sure that all commission members have had the opportunity to see and review the meeting minutes from the February 13th, 2024 meeting. Are there any members who have not had the opportunity to see those?
I move we adopt this one or approve.
Thank you. With that, I will ask for a second.
Second.
Thank you very much. I appreciate that. We will move forward in our agenda to the next section, which is the Executive Director updates. For this portion, we have a few breakdown areas of it, but I will be ceding a significant portion of my time. We have the honor of having the Attorney General for the Commonwealth, Mr. Russell Coleman, here with us today, who's going to be able to provide us with his priorities and the ways he's looking forward. Mr. Attorney General, the floor is yours.
Director Evans, members of the commission, a special welcome to your newest commissioner, Commissioner Allen. And I must say, Treasurer Metcalf is looking extraordinarily dapper today. What a great privilege to join you here this afternoon to discuss the critical work of this commission and its impact on our Commonwealth. Each of us have been sent here with a vital task and a sacred trust. Thank you for accepting this weighty responsibility. There are likely many more pleasurable ways to spend this beautiful Tuesday afternoon in the spring here in our Commonwealth than to sit in this conference room and face the darkness. But there are few more weighty. None of us needs a reminder of the dark times in which we now live. The specter of addiction has touched everyone in this room, some, particularly personally, every family in our Commonwealth. Too often it feels like this darkness continues to grow. Tonight, as we sleep in our beds, Kentucky moms will lie awake wondering, praying if their kids are safe. Treatment professionals will be clocking in inpatient facilities all over this Commonwealth, hoping to battle successfully this demon, and our law enforcement officers will be on the job long after we're in our beds asleep tonight. But for those men and women, for all Kentuckians, this commission is a spark of hope. We have the opportunity, with the resources entrusted in us, to keep that spark, to be that spark, to burn brightly and help it grow in these dark times. The coupling of your talent and experiences with the unique set of resources we have from the opioid settlements, you are a source of optimism for our future. We have a no-fail mission, and let me emphasize this. This commission and the Office of the Attorney General have a no-fail mission. We will succeed because we must. The lives of our children, our neighbors, Kentucky's next generation depends on it. This afternoon, I intend to lay out briefly my vision for the next phase of tackling the drug crisis in our Commonwealth. It's a plan of zealous collaboration. Zealous collaboration. To be successful, the Office of the Attorney General and this commission must have a strong partnership. We must also further connect this body with organizations throughout our Commonwealth. To Mr. Secretary, welcome. To focus on that necessary three-legged stool of treatment, prevention, and enforcement. When I say zealous collaboration, members of the commission, director, that's not happy talk from a committee room. It's a sincere commitment to sharing burdens and opportunities, challenge and reward. It's a sincere commitment to continue to build that culture in the Office of the Attorney General to collaborate with you. It's my hope we can continue to build upon the outstanding work that members of this commission have done to date. Let's pause on that for a moment. 58 grants awarded, $43 million invested. Truly a statewide effort, from the mountains to the purchase, and you're to be applauded. I understand in the coming months, this commission will visit several of the organizations you've supported with this significant investment, seeing firsthand the life-saving impact of the investment you made. I hope to join you in some of these visits, if you'll have me. Together, we can celebrate these organizations and the work the commission has done in making a real difference in the fight against addiction, not happy talk. We can draw attention to the outstanding initiatives available in communities across Kentucky for those in need. And just as importantly, we can show a commitment to accountability and ensuring these funds are used effectively and responsibly. With a new round of grants underway, I look forward to seeing the selections you make in the near term in these investments. These awards are about much more than a press release. They're about much more than a tweet. They're about forever changing the trajectory of our Commonwealth and those lives that we will save together. I also look forward to bringing new ideas and opportunities, again, for collaboration with this commission. As I've traveled the Commonwealth listening to families, providers, law enforcement, I've come away incredibly impressed by our strong treatment and enforcement programs. Two legs of that stool, treatment and enforcement. After several years of hard work, we have achieved enough treatment beds available in Kentucky. We should all celebrate this reality. Think of where we were a decade ago. Think of the conversations in this very room about these deficits a decade ago and the lives lost because of lack of treatment infrastructure. Now we're entering a new phase, though. When Kentuckians are dying from a single pill of pressed fentanyl, we have to build up the third leg of the stool, which is prevention. I'm proud to announce the Office of the Attorney General is in the midst of developing new prevention initiatives focused especially on youth education. When we're in an environment where children are experimenting with these dangerous substances as early as 11, we're seeing it in late elementary school, we have to have conversations with our kids earlier and earlier. And look, as a dad, I want to protect my kids' innocence as long as possible. Biblically, we're called to guard their hearts. But when we see these kids as early as 11 sampling these dangerous substances, when a young person with limitless potential is stolen away because he or she thought they were taking a Xanax, it's our responsibility, yours and mine, to prepare them for this threat they're facing in a new threat environment. When I was privileged to serve as the United States Attorney for the Western District of Kentucky, we partnered with Jefferson County Public Schools to bring parents who had lost their children into the classroom. Those courageous individuals, women like Debbie Raines, they could connect with students and deliver a powerful message of what's facing our youth. The results were incredible. Look, I'll be the first to admit that someone who looks like me and wears a suit, sounds like me, may not be the most effective presenter to a middle school crowd or a high school crowd. So we'll go out and find those who are. We know those who are. Everyone in your chair has relationships with those who are and would be willing to serve in this capacity. I hope to establish a statewide network of prevention trainers and advocates, connecting the life-saving message with the right messenger. But the Attorney General's office can't do this alone, and in the spirit of collaboration, I'd ask this commission to come alongside us to build a gold standard statewide prevention effort, to finally scale up a statewide prevention effort commensurate with the threat that we're facing. Now, it might shock you. I know that not all great ideas come from Frankfurt. We have some great prevention efforts, but we'll need more if we're going to change a generation, if we are going to turn this ship. So I hope to tap into your expertise, your experiences to garner what works, to see what we can scale up to save lives. Look, I will beg and I will borrow and I'll steal from any idea that will work here in the Commonwealth or across the country. As you consider your next round of grant applications, I'll respectfully encourage you to place a strong emphasis on boosting that third leg of the stool, needed prevention efforts at scale or that will be scalable. Now, of course, we can't make everyone happy in our leadership roles. With limited resources, limited time, there are difficult decisions that we're facing in the near and medium term. It's my hope that those who watch this commission will take comfort in the fact that these difficult decisions are not being made lightly. They are coming and will come after careful study, after thorough consideration, and honest conversation. Being responsible stewards of these settlement funds, which have been purchased by the pain of Kentucky's families, demand nothing less. In that spirit, I respectfully ask this commission to step back from previous proposals to allocate $42 million to ibogaine research and the unproven, expensive clinical trial for a psychedelic that is, as you know, currently a Schedule I drug in the United States. This $42 million and those resources that you are a steward of, as am I, some call it blood money. Too precious. This is too precious to gamble away with that degree of risk at that amount. That's not to say, and that is not to say, my friends, that this commission shouldn't be on the cutting edge of innovation. I believe we can push the bounds of addiction response, and we should together. I will ask Director Evans in the near to medium term to bring before this commission a proposal to establish a $5 million pool of resources for research and innovation grants. With a new fund to facilitate big ideas, Kentucky can keep pushing the outer limits of addiction strategy. And if someone brings forward, let's return to ibogaine, because I know it has been a focus of our friends in the press and an intense interest before this commission. If someone brings forward an ibogaine research proposal that fits the criteria of this new innovative grant proposal, I hope this commission will give it full and fair consideration. It's not zero sum. That's not what I'm proposing. Before I close, and I've gone longer than intended, before I close and answer any questions from the commission, I'd like to end where I began, with gratitude. I'd like to say thank you personally to each of you for serving on this commission, for giving your time and looking again into this darkness we face. Thank you for being a beacon of hope in a world that is increasingly dark. Your work could not be more important. And I look forward to coming alongside you as we fight this scourge affecting our Commonwealth and to save lives. With that, thank you for affording me, members of the Commission and Director, this amount of time, and certainly I welcome any questions that you may have.
Thank you, General Coleman. We appreciate that and the time that you allotted for the commission. With that, I'd like to open it up to commission members for any questions for Attorney General Coleman.
Not a
Is it- we'll
question
go-
so much as, is this okay?
Then
Not a
okay.
question so much as I am glad to hear you say that with the past interest in Ibogaine, it's not completely finished, possibly thinking about some type of clinical research. So I appreciate that because
Commissioner Butcher, given the loss that you and your family have endured, I certainly understand that interest in hope, and so it's not a zero-sum game. But as a steward of this blood money, of these resources, I simply cannot support the investment that had been put before you previously. Thank you, ma'am.
Secretary Freeland?
I don't, Attorney General Coleman, first, thank you. My lateness, I want to make everybody in this room feel better about themselves. I went to the wrong place. So everybody gets to feel better about themselves today. But second, I want to thank you. You're laying out a vision for us. You're here with us today. You are really taking the bold step and the responsible step and the brave step of putting yourself out there, giving us a vision around prevention, addressing head on some of the things that we haven't agreed on this committee. I think I'm probably was on the least side of the Ibogaine piece, but and we're still friends, right? And we get to have real discussions here. And I appreciate you bringing your vision. I appreciate you being with us. I just want to say how much already working directly together, I think we are making a difference and we will make a difference. And your vision and your challenge to us is going to go a long way to getting that done. So I just want to say thank you.
Well, I'm grateful for the kind words, Mr. Secretary. We want to be a partner, and partnership means an open door. It means transparency. Come to me, come to the members of our team. We will not agree across the board. I'm a dad before I'm the Attorney General of this Commonwealth, and with a 16-year-old, a 13-year-old, and a 4-year-old, it is a frightening environment in which to raise kids, and that motivates me. So look forward to the good work. We have the resources. I had a conversation this morning with someone about best practices in Virginia, Georgia, Tennessee on the prevention front. So we're going to look, when I say beg, borrow, and steal, that's not just because I'm from West Kentucky and that's how we talk. It is the reality. I will borrow anything that works best elsewhere. And I would encourage you to look as well. Not the originator of all good ideas. That's the talent in the seats to your left and your right. So I would encourage you and your colleagues to bring to us what works elsewhere. So I'm grateful for your kind words, Mr. Secretary.
I just also want to thank you, General Coleman, for coming and laying out a vision. I think you and I shared the same idea that we got one shot at this. We got 17 more years of this money, and it's gone. And if we don't solve this in our lifetime, shame on us, because this problem came in our lifetime. I've spent 20 years looking for ways to improve upon where we were yesterday as it relates to addiction. And it's incumbent upon us to really look at the next 17 years, how we spend every dime of this money. That we're moving the Commonwealth forward and we're moving this problem of addiction backward. So I thank you for being engaged.
Thank you, sir.
Mr. Attorney General, I'm back here, Dr. Rupp. Yeah. I just want to applaud you. I want to echo the sentiments that Eric and Van have shared about just casting the vision and the leadership. We really appreciate the clarity. That really is incredibly helpful. And we're doing some things in central Kentucky and Taylor County along the lines of prevention that I think we see the need there. We see that it's very appropriate and very applicable. But just for everyone in the audience, I do want to mention one thing that will help elucidate or illuminate kind of the overall phenomenon when we talk about addiction at a society level. And that is this, that addiction is typically a generational issue. And so when we treat the parents, we essentially and indirectly are providing prevention for the children. So I think that typically what we want to do as rational beings, as humans, is to create clear and distinct categories. So here you've got recovery, here you've got prevention, here you've got law enforcement. And while they each are unique, we really do a disservice by putting them into silos. So I would encourage all of us to consider addiction from a holistic standpoint, prevention, treatment, law enforcement, all of it kind of going together to represent our efforts. But again, thank you very, very much.
I appreciate that notion of tearing down silos, and it's something that's in law enforcement has been a limiting factor for us for years. We don't necessarily collaborate as well as we should. We're getting better at it. The way when I talk about that three-legged stool, and I want to be very clear of treatment, enforcement, and now leaning in on prevention. I'm not advocating for short shrifting the treatment component, or especially the law enforcement component. I'm a prosecutor. That's how I view this. But we have to contemporaneously do all three, to your point. The stool falls over if all three of those legs aren't equal, which is why that metaphor just works so well in this space. We need to continue doing, and we will. I pledge we will continue to be enforcement, to be robust in our enforcement efforts. We have. I'm so proud of the treatment space that we've built out here. Not everywhere. There are areas that certainly lack beds, but again, just think about where we were even 5 years ago. But to think of the scale of the threat, where one pill, think of that Beth Warren article, young Wyatt Williamson, in the cover of the Courier Journal not that long ago. The young man that was a sophomore at U of L thought he was taking a Xanax, had a modeling contract on the West Coast. And that article ended with his mom holding his hand, disconnecting him from life support and donating his organs, and all of that potential destroyed. The fact that we don't have a statewide prevention effort in this Commonwealth, shame on us. If we're going to be responsible stewards of this money, we have to get after it. We are losing. You know that. I'm not here to preach. I'm here to commit and offer to work alongside you. But shame on us that we don't have a more robust prevention effort in this Commonwealth, given the scale of the poison that's dumping into the Commonwealth from over a porous southwest border.
Any other members with any other questions for the Attorney General?
I'm the rookie, and I was going to just be seen and not heard, but you're the kind of man that people like to follow, and I appreciate you, General. I'm a just say no kid, so I appreciate you highlighting prevention, because it worked for me, and honestly, it's worked for my children. They're both productive members of society. They don't rely on drugs. So I've been blessed in that regard. I don't want to say that conceitedly in any way, but I'm glad to know that one of your initiatives and highlights is that of prevention. So thank you, and thank you for requesting me and recommending me, sir. Hope to serve you well, and this commission well.
I'm grateful for your kind words, and again, thank you for your service on this commission.
Good afternoon. I just want to say, as the chair of the Prevention Committee, I'm very honored to work alongside this team, and I am honored to have your support for leaning into the prevention manner. I also have an 18-year-old teenager who has now gone off to college in big old Washington, D.C., which makes you even more afraid that he's far away. But we know, as I represent Jefferson County, Louisville, West Louisville, the opioid issue is growing every day there. So I am committed to work with our counterparts and individual groups in that area to make sure we're doing a little bit more for prevention, because I too believe that we could be doing a lot more, and I'm interested in leaning into the partnership with JCPS a little bit more and helping our colleagues and groups in Jefferson County apply more for these grants. We have a deficit in the number of people in the Black community who are actually applying for these grants. So I want to make sure we get that money across the Commonwealth to include West Louisville. So I'm honored to be here on the team and honored to do this job. So thank you very much for your partnership.
Thank you, man. I'm glad to see you bring such a fire to serving those that live west of 9th Street, which is which is a term that many in the room may not be familiar with. It wasn't before I moved to Louisville, but west of 9th Street is an area that has been particularly decimated, particularly hard hit. There are myriad reasons for that, but we have to tackle this with a sense of urgency, and look forward to partnering with you, ma'am.
Thank you. I won't be remiss and make sure we have Dr. Freeman online and to make sure if she has any questions that she has an opportunity to ask those.
Yes, thank you, Director Evans. No, I just wanted to say thank you to the Attorney General for coming today and sharing his vision. And we look forward to partnering and collaborating, as you mentioned, and really being wise stewards of the funds that we've been entrusted with. So thank you.
Thank you, ma'am. Look forward to meeting you in person.
Well, General Coleman, it looks like you have run the gamut. So thank you very much for your time today. We appreciate your time, your vision, your commitment to come to this commission and to present to the community your view of how we go forward. So we thank you for taking the time and doing that. And with that, we understand you have a busy schedule, and so we appreciate you are welcome to stay, but we also understand that you have some commitments that you also have to make. So again, we appreciate you and thank you for your time.
I'm grateful for the hospitality. Godspeed.
Thank you. Thank you. Thank you, everybody. With that, we will move into the next phase. That there are a few more portions of the update from the executive director. One of the things we wanted to make sure that happened was that some of the work that's taking place behind the scenes as we continually improve the process gets brought to the commission members, so you're able to hear that and understand what's going on. And with that, I'm going to ask Deputy Director Halliday to make a presentation to you all about some of the things that are going forward to move the commission forward. With that, I'll turn it over to her.
Thank you, sir. I wanted to give you an update on a couple of issues. We'd heard from commission members when we came into office that there was some concerns around how reporting was going to be done on the grants, how we would be tracking that information. So we're still working on a long-term plan for what that looks like, but wanted to let you know that we have been, with many thanks to Amy Andrews in Van's office, developed an online form that the grantees will be able to fill out and put right into our IntelliGrant system. So that will make tracking how the funds are being used and the outcomes of those much more easy for us to look at and to bring back to you with examples. So wanted to let you know that we will be sending communication to all the grantees next week about how that will change. And then going forward, all reporting for grants will happen online in an electronic system that we can monitor. We're just going to keep making it more robust as we move forward. So wanted to let you know about that. And then in your packet, you got a copy of some grant application suggestions, some guidance for as you start the hard work. Our grants are rolling in, and I think within the next couple of weeks, the committees will be meeting to start looking at those grants. One of the things we heard from you was just that there hadn't really been a lot of clear guidance around how to sort of manage that process. And I think you all did an amazing job getting through that first year of grants and took the responsibility very seriously. So there's nothing on here that I think is going to be surprising to you, but wanted to just give you something that you could use when you're having your discussions, that take what's in the regulations, what's in the notice of funding, and just gives you some structure by which to kind of walk through and guide your discussions. It's not a scoring matrix. It is not something you will have to fill out forms for. It is not required for you to use it, but it should help you just guide your conversations. And we hope that you will find that helpful. And if you have feedback or want to see changes in that for future grant processes, please do let me know and we'll try to accommodate that. That's all I have, sir. Thank you.
Thank you, Jesse. We'll move on to the General Commission discussions. One other thing in regards to the applications, to date, we have 11 applications that have been officially submitted. 2 of those will go to the prevention with the rest assigned to the treatment subcommittee. There's more than another 170 applications open in the portal, which closes on March 31st. So we know that those things are in there. They just have not been completed yet. Moving to the next phase for the General Commission discussions, I do want to catch one thing which I intended to do at the beginning, but I want to make sure to properly welcome our newest member, Mr. Allen. to welcome you to the commission, and also give you the opportunity if you want to say any words to the commission. So,
Well, thank you, sir. It's an honor to be here. I'm Darren Allen. I'm from Rockcastle County, down the southeast part of the state, a 606 guy. But I hope to bring some passion, experience, and good judgment to the commission. I hope to help and represent well. But it's truly an honor to be here. I joked earlier, I feel like a Chevy Chevette showing up at a Corvette convention, but I'm honored to be here and look forward to working with you all. Thank you, sir.
thank you very much. We appreciate that. With that, I know want to open it up to all the members if there's any additional discussion or things that one would have. I know Dr. Freeman potentially had something that she wanted to mention to the commission. So with you being online, I'll make sure we get to you first so we don't somehow miss you. But again, Dr. Freeman.
Thank you, Director Evans. So what I wanted to share a little bit with the commission today is about a project at the University of Kentucky that some of you are familiar with, maybe called RADOR. And RADOR is a project that is funded by the National Institute on Drug Abuse. Dr. Svetla Slavova and Dr. Jeff Talbert are the principal investigators on the project, and I'm a co-investigator on the project, and there's actually quite a large team. And I wanted to just provide an overview of the project because, you know, we really think this is exciting, and there's some opportunities perhaps for the information that this system is going to collect that might be able to help support some of the work that the commission does. So RADOR stands for Rapid Actionable Data for Opioid Response in Kentucky. So RADOR Kentucky. And what the goal of RADOR is to create an innovative statewide system to inform prevention and response efforts aimed at reducing the burden of opioid use disorder in Kentucky. Really building on what we currently have, we already have a great, state surveillance system. There's been a lot of work through KIPRIC, the bona fide agent for the Kentucky Department for Public Health, and then building on what's already there with surveillance, and also keeping in mind some of the advances and things that we learned with the University of Kentucky's Healing Community Study, where we developed really these robust data dashboards and data systems to monitor the uptake and the outcome from evidence-based practices in the 16 communities that participated in the Healing Community Study. And so the vision for RADOR is really that it will ingest data from multiple state agencies and really take that data and implement advanced informatics algorithms for really fast data processing and analysis. This will help shorten the time for delivering analytic results, to provide real, predictions and actionable data to decision makers for opioid overdose prevention and control planning. Currently, there are numerous partners from the state that have already signed data use agreements that are already, really working collaboratively with the RADOR project. The Cabinet for Health and Family Services, the Kentucky Justice and Public Safety Cabinet, the Kentucky Injury Prevention and Research Center, the Kentucky Cannabis Center, the Kentucky Board of Emergency Medical Services, and several other organizations, CDAR at UK and the Institute for Biomedical Informatics. And what we really envision is that it will be a platform for agencies and organizations to use for a variety of activities. It will have customizable data dashboards for reporting and visualizations at the county level. It can be used to disseminate data briefs, other relevant materials. It can help with ongoing forecasting and prediction estimates, to help inform resource allocation, and then inform the planning and evaluation of evidence-based practices that are aimed at preventing opioid overdose in Kentucky. And we submitted this grant a couple years ago, and when we submitted the grant, we envisioned the system, being useful to the commission by providing access to data for these activities that I just mentioned. And so I just wanted to bring up the RADOR system as a potential system as it becomes fully developed that could be useful for supporting the commission's work. And so I'll stop there. I know it's just a brief overview. Dr. Slavova and Talbert will be following up an email with just a sort of a more detailed fact sheet, if you will, about RADOR, so that you might have a little more of an understanding. But I'll stop there so as not to take up too much of time today.
Thank you, Dr. Freeman. We really appreciate that. Any questions for Dr. Freeman regarding that? Okay. If not, any other comments or issues from any members of the commission that they want to bring forward at this time? Okay, seeing no requests for other discussions, we'll move into the new business phase. The first item in the new business is the adoption of prevention and reform application review location change. In our previous meeting, we voted to hold the Prevention and Reform Committee meetings at the Capitol Annex, but we need to vote to change the location of these meetings to the Capitol East building. So may I have a motion to approve the change in the Prevention and Reform Committee meeting locations?
So moved.
Motion, may I have a second?
Second.
Any discussion? All in favor? Any
Aye.
opposed? Seeing none opposed, the motion passes. Thank you. We will adopt those moving forward. The second item under new business, which just came up as something yesterday, it's extremely new, but we wanted to make sure and take this opportunity that since we have you all here to move forward and look into this. We have received information yesterday about a grantee that would like to make changes in their grant agreement. The organization submitted a request in writing, and several of the requested changes aligned with what was reviewed and approved by the commission. However, upon staff review, we identified approximately $50,000 that does not fit into the areas which were reviewed by the commission or approved by the commission. So at this stage, we have two options. The first, we can make the modifications that they've requested that are consistent with the commission's approvals and intent originally, and request that the additional funding be returned since they have said they are unable to utilize it in the way that they requested and was approved. The second option is to request the organization to alternate their modification request and have that brought forward to you during the grant review process. Now, what that would require is that they would basically push forward another updated proposal. It would go through the process along with the other proposals that you have, and then it would also go through contracting and set that part in motion. We as staff have concerns about going that route and doing that, but we wanted to make sure we gave an opportunity to the commission since the commission members voted on that and approved that. So any comments or questions?
How would the money be returned?
What's it?
How would the money be returned if we took that option?
So they would be required, the money is currently already in their account. They would be required to return that money to the commission, and the money would go back into the fund, which would allow for it to be reallocated at another time for the commission.
I will say, Director Evans, as a funder, it's not unusual to have contract modifications. We do it all the time because things come up. People plan, we're going to do A, B, and C, and just C falls off the table and doesn't work anymore. And so I'm accustomed to that procedure to let them resubmit a new plan for that $50,000 and do a modification to that contract.
Any other comments from any of the other members?
Are we able to find out who, what, when, in other words, more information?
So there's the information I'll pass this time again because I don't want to get too far into the details based on what the commission may say. I will say that again, this is a portion of their funding. It's approximately a total of about $250,000, which is what they were approved for in total. The other funding levels have been identified and they're able to execute on those fundings. It is the remaining $50,000, which they have come back to us on and said, we are unable to do that under the guise of what was done initially, and therefore it requires modification. So that's the general outline without getting into more details of the individual organization, so we don't put them out in this format. So I'm not sure if there's any.
Mr. Chair, I think we could probably just say that the request, they did make a modification. We reviewed it to make sure that it was consistent with what was asked for originally. They are able to put some portions of that funding into areas of the budget that had been approved. The additional money was for capital overhead for building maintenance, which was not considered at the time by the commission at all. So just if that's helpful.
That actually is very helpful, since it's really outside of the scope of what we approved. I think it'd be great for us to think about a process for that, because Van's right, stuff gets modified all the time. But that almost sounds like it's outside of the scope of what we would have ever approved. It's, I don't know if you need a motion, but it sounds like we should get that 50 back, and then they can reapply. And by the time, they reapply, and you said the portal's closing
The 31st.
31st, they'd have time to reapply for that. So that makes sense to me from the description I heard.
Commissioner Butcher, does that help you at all in terms of clarification?
Yes, thank you.
Okay. Saying that going forward, I guess I'm not sure if that has any altering your opinion. You're still of the same mindset.
I'm fine with either way.
Okay.
If there's a motion, I'm fine either way.
Good.
Well, I would move that they would return that $50,000, since it sounds like it's outside the scope of what we would have otherwise approved.
Is there a second?
I second it.
All ayes?
Aye.
Any nays? With that, the motion is accepted, and we move forward. Thank you very much. That has concluded the new business which we'd had. The next thing is for opening for public comments.
Before we do that, can I bring up an issue?
Absolutely, sir.
So we have a number of meetings scheduled to review grants. But Commissioner Butcher has a conflict on the 16th of our committee. What process do we need to follow to, I know we have to do that publicly to change that date.
Yeah, I think if we get with staff, we can go through and make the motions to coordinate with you in the subcommittee to
Okay,
make those changes.
okay.
Do you know what date now?
No, we haven't had a chance to talk
Okay,
about that.
okay.
At this time, my understanding is that we have no one signed up for public comments. I will make the last offer in terms of if there's anybody who neglected or came in after the offering to sign up for public comments. Again, at this time, please step to the podium, and we will accept the comments. All right. Seeing as there is none, and are there any other announcements from any other commission members that need to be made at this time? Having no additional announcements, we can conclude this meeting. May I have a motion for an adjournment?
I make a motion that we adjourn.
Second.
Motion made and second. Any discussion? All in favor?
Aye.
Any opposed? The motion passes and we are closed. Thank you very much, everyone.